A fracture after 55 does not always begin with a dramatic accident. It may begin with one missed step or one moment of dizziness beside the bed. The fall lasts seconds. The consequences can last years. And the most dangerous part is that the real problem may have started long before you hit the ground. Your bones can weaken silently while you still feel healthy, active, and unaware. The real question is whether your body is already warning you before a small injury takes away your freedom. Bone is living tissue, constantly being removed and rebuilt. When you are younger, your body usually replaces old bone efficiently. As you age, that balance can change. Bone may be removed faster than it is replaced. Its outer shell can become thinner, and its inner framework can become more fragile. You can look strong and feel no pain while your bones become less able to absorb an ordinary fall. This is why osteoporosis is often called a silent disease. It usually does not announce itself with daily pain. For many people, the first obvious sign is a fracture of the wrist, hip, or spine. A spinal fracture may even occur after bending, lifting, or coughing and may be mistaken for a pulled muscle. Sudden back pain, unexplained height loss, or a more stooped posture should not be dismissed as just getting older. They may mean part of the spine has already weakened or collapsed. Women face a particularly important period around menopause because falling estrogen levels can accelerate bone loss. Men usually lose bone more gradually, but that does not make them safe. Their osteoporosis may simply be recognized later. Low body weight, smoking, inactivity, poor nutrition, family history, and a previous low trauma fracture can all increase risk. There is another layer many people overlook: health conditions and medication. Rheumatoid arthritis, thyroid disorders, digestive diseases that reduce nutrient absorption, kidney problems, and hormone disorders may contribute to weak bones. Long-term corticosteroid use can also reduce bone strength. Other medicines may increase fracture risk indirectly by causing drowsiness, blurred vision, confusion, or a drop in blood pressure when you stand. Fracture prevention may therefore require a review of your bones, muscles, balance, eyesight, health conditions, and prescriptions. Never stop a prescribed medicine because of something you hear in a video. Instead, ask your doctor or pharmacist whether any medicine or combination of medicines could be affecting your balance or bone health. That conversation may uncover a risk that no supplement could fix. Now consider the most important warning sign: a bone that breaks after an injury that should not normally cause a fracture. If you fracture your wrist after falling from standing height, or a vertebra after a minor movement, the goal should not be only to heal that injury. The deeper question is why the bone failed. Treating the fracture without investigating the cause is like repairing a cracked wall while ignoring the foundation underneath it. A bone density scan, usually called a DXA or DEXA scan, measures bone mineral density, most commonly at the hip and spine. Current United States guidance recommends screening women aged 65 and older, as well as younger postmenopausal women at increased risk. For men, routine screening remains less certain, but a previous fragility fracture, long-term steroid treatment, height loss, or other major risk factors should prompt a medical discussion. A clinician may also use a fracture risk calculator and blood tests to look for vitamin deficiencies or an underlying condition. But finding weak bones matters only if you act on the result. The first defense is movement, and walking alone may not be enough. Bones respond to controlled load, muscles respond to resistance, balance improves when it is challenged safely. A strong plan combines weight-bearing activity, strength training, and balance practice. Brisk walking, stair climbing, resistance bands, carefully chosen weights, chair rises, heel raises, and supervised Tai Chi can all serve different purposes. The goal is not to become an athlete. It is to remain difficult to knock down and strong enough to recover when balance slips. Stronger legs help you catch yourself. Stronger hips help absorb force. Better balance gives you an extra second to react. That second can be the difference between a harmless stumble and a life-changing fracture. More exercise, however, is not automatically safer. People with severe osteoporosis, spinal fractures, significant pain, or poor balance may need professional guidance. Forceful forward bending, rapid twisting, or high-impact movement may be unsafe for some individuals. The best program is not the hardest one. It is the one that challenges you safely and can be continued week after week. Nutrition is the next piece, but it is often oversimplified. Bones need calcium. Vitamin D helps the body absorb calcium, and protein supports the muscles that protect you during a fall. Useful foods may include dairy products, calcium-fortified alternatives, tofu made with calcium, beans, leafy vegetables, fish with edible bones, eggs, poultry, and other protein-rich foods. The answer is not one miracle ingredient. It is a consistent eating pattern that supplies what bone and muscle need. Supplements should fill a real gap, not replace judgment. A larger dose does not guarantee a stronger skeleton. Needs vary with diet, age, kidney function, medical history, sun exposure, and sometimes blood test results. Unnecessary high doses can cause problems or interact with treatment. Before buying another bottle, find out what you are actually missing. Then inspect the place where many fractures begin, your own home. Loose rugs, dim hallways, electrical cords, slippery bathrooms, cluttered stairs, unstable furniture, and objects stored too high can turn one moment of inattention into an emergency. Improve lighting, secure or remove rugs, add grab bars where needed, use stair railings, keep frequently used items within easy reach, wear supportive, non-slip shoes, and never walk through a dark room while half asleep. Falls can also begin inside the body. Poor vision, foot pain, numbness, muscle weakness, dehydration, and low blood pressure when standing can all make you unstable. If you have fallen, nearly fallen, or started holding walls and furniture while walking, do not hide it out of embarrassment. These are early warnings, and early warnings give you time to act. For people at high fracture risk, lifestyle changes may not be enough. Prescription osteoporosis treatments can reduce fracture risk in appropriate patients by slowing bone breakdown or supporting bone formation. The correct treatment depends on bone density, fracture history, kidney function, other illnesses, and individual risk. The truth is that a major fracture often begins years before the fall. It begins with silent bone loss, weakening muscles, an unreviewed medicine, poor balance, or a hazard you have stepped around 100 times. After 55, do not wait for a broken hip or wrist to prove that your bones need attention. Ask about your risk. Take a minor fracture seriously. Build strength safely. Correct genuine nutritional gaps. Review medicines that may affect stability. Remove hazards hiding in plain sight. A small injury should be a warning, not the moment your independence begins to disappear. Protecting your bones is not only about preventing pain. It is about protecting your ability to stand, move, choose, and live on your own terms.